at that diagnosis. And you have to break that news, I know, to a lot of women, saying, you know what, breast cancer, it's here, it's real. Now let's put together a plan. But you're seeing some people coming in who maybe have some misconceptions about what each procedure can do.
Yeah, I mean, one of the things that we're concerned about nationally is a trend towards increasing mastectomy rates, which, you know, a lot of the problem is we don't really understand why. So from my perspective, I think there's some really good reasons to choose it, and then there's some reasons that maybe aren't so great. Okay. So I think a lot of it is about making sure that we're really well informed when we're making that decision. So good reasons to choose mastectomy would be things like, you know, you've had a history of radiation in the past. Mm-hmm. So some women have had breast cancer and have a second one come back, and they're really not a candidate for anything other than a mastectomy. Okay. And then some women have genetic predispositions to cancer where that preventative aspect of mastectomy becomes more important. But by and large, for most women who have something that's resectable, that's relatively small and thankfully found on screening, lumpectomy is just as good an option as mastectomy and does offer some benefits in terms of preserving the breast, preserving body image, and things that you would normally think about with that. So the biggest misconceptions I see, women come in a lot thinking that mastectomy is going to make the difference between chemotherapy or no chemotherapy. Right. And I think that's one of the more important things to really understand is that chemotherapy is used based on what the cancer type is. So it has nothing to do with what we do surgically. Oh. Yeah, so kind of a big one. Right. And that changes the conversation a lot. I bet. You know? The other one is just what your risk of breast cancer is. So it's important to know that, you know, if you have a family history of breast cancer, you have something else going on, of course your risk might be a little bit higher. But most women don't. And so most women who come in aren't carrying a gene that predisposes them to breast cancer. Okay. And so what that means is that your risk for developing a new cancer is relatively lower than what you would think. So for most women, that's 0.5% per year, cumulative over time. But you can see how if you come in and you're about 60 years old and you've got breast cancer, your risk for developing a new cancer is maybe, you know, in the next 20 years, 10%. So by the time you're 80, 20%, 10%, and you cut that down by 90 by doing the mammograms, by doing the mastectomy. So what you've done is you've gone from a 10% risk to, like, you know, 1% risk-ish, okay? And is that worth it, you know, by the time you're 80? Because, you know, that's really, you're giving up a lot in a short period of time, and the benefit may not be all that what you're hoping it to be.
People long to have that face-to-face time with their doctor, but we know people go to the internet. Are there good places for people to go in terms of getting this reliable information? Yeah, I think, you know, the internet's like a really good tool as long as you use it well, you know. I would avoid just randomly Googling things, you know, although we all do that. Right. If you're sticking to a well-established website, so you're sticking with the known cancer organizations, our website, the major hospital websites, they'll give you enough general information that you can sort of get a feel. But that discussion of really about what to do, probably better to have it in your surgeon's office. And it takes some time to think about it as well. Maybe bring a loved one. Yeah, I think that's really important. I mean, we have a nurse navigator who sits at each of these meetings to help try to sort that out and really be a second set of ears. Some women come in and they really know what they want to do, you know, and they're really able to process that. I think for most women, when you come in for that first visit, it's like a little bit like drinking out of a fire hose. No, you know? It's a lot. Yeah, it's a lot all at once. It's really a lot. So, you know, there's nothing wrong with saying, okay, you know, give me a minute or two, and you know, I'll come back later in the week and we'll figure it out. Well, we got to wrap up for now, but we'll hope you'll come back soon. Yeah. You mentioned genetics. We want to talk about that a little bit more because it's fascinating stuff. So we'll see you in a few weeks, I hope. Sounds great. All right, right now we got to take a break. Coming up next.